The Lord is here. I must tell you this. Please, don't be caught unaware, because we believe that the Lord is here. We want to have our next program. And the discussion is patterned alongside our kidney. I believe that after this discussion tonight, you'll be well enlightened and you have understanding. And if by adventure you have gotten one of these diseases that will be mentioned, your healing is assured in the name of Jesus. The Lord has brought our way a medical practitioner, a professional in this field, and it's no other person than Dr. Awodeji Anthony. Can we celebrate Jesus as he comes forward? Let's appreciate it. Let's appreciate Jesus.
Praise the Lord. I want to appreciate the organizers of this program for giving me the opportunity to speak with us this evening. So I hope that as we listen, we'll gain more knowledge and we'll gain more understanding of the workings of the kidney. So I'm talking about the kidney-associated problems and their solutions. So from the projection, we can see a normal kidney on the left-hand side and a diseased kidney on the right-hand side. Okay, they are trying to bring up the slides, so let's give them time. So I'll be following the outline, introduction. I'll talk about brief anatomy of the kidney, then the functions of the kidney, the problems that we encounter with the kidney, and then some of the symptoms that come about with these problems, and then the complications of kidney disease, then the tests we'll do to investigate kidney disease, and then prevention and treatment. So as a way of introduction, the kidney is a major organ of the body, and each person has 2 kidneys. So that is why it's possible for us to be able to donate one of our kidneys into friends or family members, as the case may be. So they are located in the posterior aspect of the abdomen, and they are usually covered by the lower ribs, a form of protection on the upper pole of the kidney. And the kidney, the size, the weight varies. Usually the left kidney is bigger, slightly bigger than the right. And then the right kidney is slightly lower than the left because of pressure from the liver on the right side. Then usually the weight in men is about 150 to 160 grams, while in women is about 135 grams. Then each kidney is made up of a subunit known as the nephron. So the nephron, they are the main functional units of the kidneys. So each kidney contains about 1 million nephrons. So these nephrons are what would help us in filtering blood and bringing out urine. So the kidney takes up about 25% of the blood coming from the heart. So at any point in time, if there is a compromise, if there is any problem with this amount of blood getting to the kidney, there may be problem resulting in the kidney. So the nephron, I don't know if the pictures are up now. So the nephron, we can see a picture showing what a nephron looks like from the kidney. So there are blood vessels that come into the nephron. There is an artery and there is a vein. So the artery takes blood from the heart and then supplies to the glomerulus, an aspect of the kidney that is involved in filtering. So when the blood gets to this glomerulus, it takes away the important parts, such as proteins that are necessary for body metabolism, glucose, and other important things. It takes it away and then keeps it back in the blood while it filters out, excretes waste products from the kidney. So as the waste product leaves that place, it goes through the tubules, and then there is a complex mechanism that takes place. So the body, based on the necessity, so depending on how much water you have in the body, depending on how much electrolytes you have, the body is able to decide, and then the kidney selects the important ones, the electrolytes like sodium and potassium, calcium, phosphate, magnesium. So the kidney is able to regulate the amount that will be taken back into the circulation based on what the body needs. And then also the amount of water that will be restored into the body. So the kidney is the one that will be able to decide that, okay, since morning you have not drank enough water, so the kidney will not allow too much water to be going through the, entering the urine. So you'll notice that if you don't take enough water, there will not be enough urine. And when you take too much water too, you'll be making plenty urine. So that's basically the function of the kidney. So when there is problem, so all these things cannot be done. So let me just run through the functions again. So it filters the blood, then it maintains water balance, regulates electrolytes, the important electrolytes, the sodium and potassium, because they are necessary for transmission of activity all over the body. Then acid-base balance. Normally the blood acid-base level is supposed to be between 7.35 to 7.45, and any alteration in this balance can result in problems. So the kidney is also responsible for maintaining this balance. So there are also some important hormones that are secreted by the kidneys. So the first on the list is erythropoietin. So this is an hormone that is responsible for maintenance of the blood level. It's important in production of red blood cells. So usually if there is any problem with the kidney, you notice, to mention that the blood level will suddenly go down gradually, keep going down, and then you need a replacement of this hormone. Another important hormone is the calcitriol. So this calcitriol is responsible for bone formation and maintenance of healthy bone. So if there is a problem with the kidney, there will be problem with the bones, and then the person can be prone to fractures easily. Any small fall, and then the bone has fractured. So that's part of the function of the kidney. Then the kidney also produces renin, which is important in blood pressure control. So that is part of why if there is a kidney problem, the blood pressure may be difficult to control. And vice versa, the blood pressure can also result in kidney problem, which we'll see as we go on. So there are different types of kidney problems. So, and there are a wide range of them, but I would classify them into the following. We have the acute kidney failure, or acute renal failure, or acute kidney injury, as the case may be. They are just interchangeable names. So usually at this point in time, it's just a rapid failure of the kidney function. So the kidney fails to do its work due to one thing or the other. However, at this point, it can still be restored. The function can still go back to normal. But if it progresses, it can develop into what they call the chronic kidney disease. So at the chronic kidney disease level, at this point, what we try to do at this stage is to prevent the function from getting worse, from going down more. So it means that at this chronic kidney disease, there's already some form of damage to the kidney, which is irreversible as it may be. So it's just to delay further progression of that damage. So while at the end stage renal disease, that is the point in which the kidney is no longer functioning. And at that point, you need something else to take over the function of the kidney. That's where terminologies like dialysis comes in and then renal transplants. Okay. So talking about the acute kidney failure. So in acute kidney failure, we have a syndrome that is characterized by a rapid decline in the glomerular filtration rate than resultant accumulation of metabolic waste. So this glomerular filtration rate is a method by which we measure the function of the kidney. So usually in normal people, it's supposed to be above 90. However, when the kidney starts becoming diseased, it gradually drops down. So what I would, an analogy I would paint in order for us to look at the glomerular filtration rate is that, let's say we have 100 people that are meant to do a walk, and then that's the standard that is as expected. Then gradually, 30 people go away, and then there's about 70 people left. Okay, let's say 40 people go, and then we have about 60 people left. So these 60 people, they can still try to manage and say, okay, I'm a 40. So they will manage and try to do the work of 100 people. But then, as time goes on, they will also be getting tired. Some people may not want to continue again, especially if there is an ongoing damage. Maybe something is making people go away. For one reason or the other, maybe they are jackpotting or something. So by the time the work now is left with 30 people, another 30 people go, so only 30 people are left to do the work of 100 people. We know that at that point in time there is problem, and they won't be able to do that work. So this filtration rate, it tries to just measure that. So it's just an analogy I paint. So normally, the normal glomerular filtration rate is supposed to be 90. However, that is the time when we still have stage 1 kidney disease. And then when it drops to 60, it becomes stage 2. And the kidney is still able to cope. And sometimes when you have stage 1 or stage 2 kidney disease, there is no problem. You don't know that anything is happening. But by the time it drops to stage 3, at that point in time, the filtration rate drops to about 30. And then at this point in time, it drops to less than 60. So it goes to, there's 3A where it's about 45, and then stage 3B where it's about 30. At this point in time, you start seeing different changes, which we'll look at later on. But by the time it now drops to 15, that's the point in time where you now need the renal replacement therapy. That's the dialysis or transplant. So when there is a rapid decline, maybe someone is doing 100 normally before, and then all of a sudden, maybe within 24 hours to 48 hours, the person gradually suddenly drops down to 60 or drops down to 30. You know that there is a problem, and it's not something that is expected. So usually it is not seen within normal population, it's more in hospitalized people. So about 5 to 7.5% of hospitalized people are at risk of this. And then in critically ill people, those are people who have more severe infections. So it jumps to about 50 to 60% of them. Then anybody who has had a kidney injury, acute kidney injury, is at risk of developing a chronic kidney injury later in life. Then you can see about 30% of deaths that can be attributed to acute kidney injury are preventable when we recognize it early, because when we look at the risk and the causes, we'll be able to see that if we recognize this, we can sort it out. So this staging on the slide is just showing us the stages of acute kidney injury. So usually the main thing that is checked is either the kidney function, vis-a-vis the creatinine level. Creatinine is a muscle enzyme that is released in the body when muscles are being broken down. So it is a way of monitoring the kidney function and used to calculate the glomerular filtration rate that I explained earlier. So apart from the glomerular filtration rates and the creatinine level, we also use urine outputs, which will be easier to explain. So in terms of urine outputs, at the stage 1 of acute kidney injury, when you have a urine output that is less than 0.5 ml per kg per hour, which means in a normal adult male, within 6 to 12 hours, if you are not making up to a liter of urine, let's say 500 ml to 1 liter of urine within 6 to 12 hours, it means there is likely a problem going on. And then if more than 12 hours, you are not making up to 500 ml of urine or a liter of urine with greater than 12 hours, it means that there is a problem. So, and it's a more severe problem. So at the stage 3, when you are not even making urine at all in more than 12 hours or within 24 hours, you can't make up to 500 ml of urine. So those are the stages of acute kidney injury. So the people who are at risk of developing acute kidney injury, like I said, people on admission. So it's usually when there is shock. Shock is just when there is a reduced blood supply or reduced blood supplying the target organs of the body. And then when there is an ongoing infection from sepsis, for one reason or the other, it also puts at risk. Older age. So because older people as people get older, the kidney function tends to get lower. That's because of aging of those nephrons. So older age puts people at risk of developing the acute kidney injury. People who are diabetic, people who are hypertensive. So diabetes and hypertension, if they are present and they are not well controlled, there is a high chance of them damaging the kidney and then putting people at risk of acute kidney injury. Presence of a chronic kidney disease is also a risk factor for acute kidney injury. When there is a heart disease, like I said, the kidney takes about 25% of the blood coming from the heart. So if the heart is not giving enough blood to the kidney can pack up. So causes of acute kidney injury. So we classify them into pre-renal, renal, and post-renal. So pre-renal just means that anything whatsoever that will make blood not get to the kidney will cause a problem for it. So if you have hypovolemia, maybe due to excessive diarrhea and vomiting, diarrhea disease like cholera, so it can cause this. If there is excessive bleeding for one reason or the other, trauma, it can cause this pre-renal acute kidney injury. In renal, it just means that if there is anything that is damaging the glomerulus or the kidney structure itself, it will result in acute kidney injury. So an example is if there is this persistent hypovolemia or persistent pre-renal cause, if it's not taken care of on time and blood flow is not restored on time, it will progress to a renal cause, which means the renal tissue itself will start getting damaged because they don't have enough blood. And then some things like some medications that we'll still see later, chronic use of painkillers like diclofenac, ibuprofen, alabukun. So if we use them persistently for a long time, it puts the kidney at risk of being damaged. Then post-renal, it just means that anything that would obstruct the flow of urine out of the kidney will result in post-renal. So it can be a urinary tract obstruction from a kidney stone. It can be that the bladder is dysfunctional, it's not allowing urine to pass. It can be a stricture. Maybe there is a urinary tract infection and then the person is bringing out some pus from the urinary tract and it causes the opening of the urinary tract to get closed. Or if there is a prostate disease in men, prostate disease, or in women, cervical disease that is causing pressure on that tract, it can cause post-renal. So the next thing is the chronic kidney disease. So for chronic kidney disease, this is the presence of a persistent abnormality that results in damage to the kidney. So when there is an abnormality in the kidney and it persists for more than 3 months, it is called chronic kidney disease, which means if there is an acute kidney injury and it is left alone and nothing is done and for up to 3 months, it's progressing to chronic kidney injury. So if there's any structural problem in the kidney and it's left alone for more than 3 months, it will result in chronic kidney injury. If there is blood in the urine and nothing is done about it for up to 3 months or more, it will result in chronic kidney injury. If there is protein in the urine as well for more than 3 months, it's chronic kidney injury. And when it's chronic kidney injury, it means that the function of the kidney is already going. Like I said, in acute kidney injury, you can still reverse it. If you sort out the problem, the kidney will come back. But in chronic, it means that the kidney is already damaged. Part of the reserve is already going. And if you leave it like that and nothing is done, everything can wipe out, and then you need the renal replacement therapy. So it's a major public health issue. About 13% of the global population is affected, which means if you count 100 people, about 13 out of those 100 people may be affected by this chronic kidney injury. And in Nigeria, as at 2022, about 13.7% of Nigerians are affected by chronic kidney injury. So this picture just tries to highlight the grading of the EGFR, like I mentioned earlier. And then we can see the picture of a normal kidney and a diseased kidney. So what are the risk factors of chronic kidney injury? So top on the list is diabetes. So diabetes, especially when the blood sugar is not well controlled, it progressively damages the kidney. So because of the excess sugar in the blood, so when the kidneys try to filter it, some of them escapes and then it causes damage in the kidney. And then it's also, there is that glomerulus, there is a basement membrane that is supposed to be filtering, but because of this diabetes and excessive sugar, it gets damaged over time and it results in chronic kidney disease. Then hypertension, that's a second leading cause of this chronic kidney injury. So, and we know nowadays, these diseases are previously they were more common among the older adults and elderly, but nowadays we can see it more among youths for maybe lifestyle changes, increased risky behaviors, intake of alcohol, tobacco. So all these things have put youths more at risk of developing this. So it's becoming concerning. Then presence of heart disease. So if there's heart disease one way or the other, like I said, when the heart is not getting enough blood to the kidney, it will result in a disease. Smoking results in the blood vessels taking blood to the kidney. It makes them constrict, not being able to take enough blood to the kidney. And then that also results in high blood pressure, so that will cause a damage to the kidney. Obesity. So in obesity, when you are bigger than your supposed height, when your weight is more than your height, so it puts your kidney at risk because your kidney will be working more than it's supposed to be working. So if it's doing maybe the work it's supposed to be doing for one person because of your size, it's doing it two people's work at once. Then another thing is black race. So being black, like we are, so it puts us at risk of having kidney disease because there are some genetic predisposition that we have, some genes that are present in us that puts us at higher risk of having kidney disease compared to other races. Then if you have a family history, if someone in your family has had chronic kidney disease, you need to be careful because it's also possible for you to develop it if you don't take care of your kidneys. Then when there is abnormal structure of the kidney, older age group, like I've mentioned, use of some of these medications. So those are the risk factors. And then the risk factors are also similar to the causes. So when there is high blood pressure and diabetes that is not well controlled. So if you have diabetes or you have high blood pressure and you control it, you take your medication regularly, your kidney will not be affected by it. But if it is left unchanged, maybe you keep skipping your medications, it increases your chances of developing chronic kidney disease. Then infections. So recurrent infections, urinary tract infections, it puts the kidney at risk because as each infection happens, there is a portion of the kidney that is damaged. And when this is persistent, gradually it will keep damaging it and then results in this disease. Then there are some autoimmune conditions. These are conditions in which some cells that are meant to be fighting infection in the body are now looking at the body as a foreign, part of the body as a foreign entity. In this case, the kidney. So when they go to the kidney, they will now start destroying the kidney, thinking it's a foreign object. So that will result in damage to the kidney. So medications, like I've tried to highlight, medications, so over-the-counter medications, if we are going over-the-counter to get medications, and then we are not using it as we're supposed to use it, or we continue to use it, they can damage the kidney. So there are different medications, and some of them even have warnings that you should not take it for so number of days. But if you keep taking it, especially painkillers, like I mentioned, diclofenac, calabucum, they are putting you, it can cause kidney disease. And then all these supplements, herbal supplements, especially the one that is imported from China and all those. So and then agbo for pain or for one thing or the other, they put your kidney at risk of damage. Then some inflammatory conditions. So these ones, they result from maybe the body is fighting an infection. It produces some things to fight the infection, but those things are now attacking the kidney. So usually, sometimes it happens in childhood. Maybe when children have upper respiratory tract infection, the body tries to clear the infection, or they are not, no, and then the body is not able to clear it. It can result in some of these things that fight infection to go and start attacking normal part of the body. Then we have some inherited conditions like polycystic kidney disease, and then other things like HIV, sickle cell disease also puts the kidney at risk in the long term. Then this image, we just try to highlight some common chronic causes of chronic kidney disease. So this is a common cause, urinary tract infection. So urinary tract infection, for those at risk, we have young women because of they have a short urethra compared to the men. People who are diabetic, they also are at risk of chronic urinary tract infection. Anybody who has any form of instrumentation of the urethra can develop urinary tract infection. So if there is a background problem with the kidney, maybe a polycystic kidney disease or a structural disease one way or the other, it also puts the risk of urinary tract infection. So most of the time, this infection ascends from the urethra and it gets up to the kidney. So that is why if it's not taken care of early enough, when you start having symptoms, it can progress and it can start damaging the kidney. So it needs to be addressed early enough to prevent damage to the kidney. And there are different names you call it. So by the time it gets to the kidney, they call it pyelonephritis. By the time it's in the bladder, they call it cystitis. So the common symptoms is that you notice that you are urinating more frequently than normal. You are feeling pain when you are urinating. You notice blood in your urine. You notice pain on your flank, side pain here. Those things are pointing towards an ongoing infection. Then another thing is kidney stones. So kidney stones is also common among younger age people about 30 years of age up to 60 years of age. So it's usually as a result of mineral deposition that now crystallize within the kidney. Like I said, the kidney is meant to clear out some of these minerals. But when they crystallize for one reason or the other, it can result in stone formation in the kidney. And these stones, depending on the size, it can go ahead and block urine from flowing out of the kidney. It can cause pain. It can cause infection to happen to the kidney. So commonly, it's usually there are people at risk. Maybe there are genetic risks, family history of stones. You have risk of stones. So it's not everybody. But then there are people who are at risk of having kidney stones. And then usually it depends. Frequent infections, urinary tract infection can predispose to stone. People who have a disease known as gout, in which the uric acid level is elevated, they are at risk of uric acid stone. And then when there is heavy consumption of food rich in oxalates, like sweet potato, chocolates, peanuts, spinach, they are putting you at risk of developing these kidney stones. So this is a picture showing the polycystic kidney disease. We can see a large kidney that is big, that has plenty different sizes of cysts within it. So usually an inherited condition, it's not something that can be prevented like other conditions. However, early detection is what matters. That is why we need to go for a regular checkup, or if we notice any symptoms around where the location of the kidney is, we should quickly seek help so that it can be detected early and then the progression can be slowed down to prevent, because apart from this cyst appearing in the kidney, it can also be in other parts of the body, the liver, and then there can also be a form of abnormal vessel dilation within the brain as well, which is the commonest cause of death in these people. So that is why it's need to quickly detect it and then be able to address it on time. So the symptoms of kidney disease. So these are important so that we'll be able to identify them. So some of these common symptoms are listed here. Fatigue. So you just notice unusual tiredness, just feeling tired all the time, not being able to do anything. And there's nothing, you're not having fever, you're not having any other symptoms, just feel tired all the time. That's a pointer to a kidney disease. Then frequent urination, more at night, is also a pointer to it. It can also be a pointer towards a urinary tract infection. frequent urination can also be a pointer to uncontrolled sugar level. So you need to be tested. If you need to go for a checkup if you notice this. Then itchy skin. There's something they call uremic frost. There will be some discoloration in the skin, and then the skin will be itching all over. So it's also a pointer. If it's persistent, it's not when you bathe and then some people react to water and they start itching. It's not necessarily that. Then nausea and vomiting. You feel like vomiting or persistent vomiting that there's no apparent cause. So it's also a point to kidney disease. Shortness of breath. You are just sitting on your own and all of a sudden you just develop difficulty in breathing. So it can be as a result of fluid accumulating because the kidney is not flushing them out, accumulating in the lungs and then resulting in the shortness of breath. Then in men, there can be erectile dysfunction, there's water retention, there is blood in the urine, then there's frequent hiccups too. Hiccups that is intractable and not controlled, so it can also be a pointer to a kidney disease. Then loss of appetite, swelling in the extremities, facial swelling, reduction in the urine output, difficulty in sleeping, reduced mental sharpness. You just notice that you are just dull all the time. So just the point. Then people who are hypertensive, the BP becomes difficult to control. So maybe you are taking 2 drugs before for the BP, and then all of a sudden 4 drugs cannot control the BP anymore. It's also a pointer to a kidney disease. So complications of kidney disease. So like I said, this complication results when the kidney is not doing its work. So like I said, the kidney is able to produce a hormone known as calcitriol to make the bones healthy and prevent it from breaking. So when this is not being produced, it can result in bone disease. And then when the kidney is affected, it increases the risk of heart disease as well. So kidney and heart, they go hand in hand. When there is a kidney disease, the heart will gradually become diseased later on. If there is a heart disease, over time the kidney will also become diseased. So it's something that we need to prevent. Then excessive calcium and potassium in the body. So usually these things are meant to be excreted by the body, but because of the kidneys are dysfunctional, they build up in the body and then they cause symptoms. And then sometimes they can put the person at risk of death because excessive calcium and potassium can result in the heart stopping its function. Build up of fluids, like I mentioned. So notice persistent swelling of both legs, facial swelling, not going up. Then anemia. So if there is kidney disease, just notice that your blood level is persistently low and then you're just tired all the time. So this image just highlights the different kidney problems like I've mentioned. So in testing for kidney disease, so there are some tests we do. First on the list is urine test. So it's something they call urinalysis. So in urinalysis, they just put a strip in the urine and it's able to detect several things. So you can detect the presence of protein in the urine. So if there is protein in the urine and it's persistent, it can be a pointer towards a chronic kidney disease. And can be a pointer to an ongoing infection, can be a pointer to these 2 major things. Then you can also detect the presence of glucose in the urine. You can detect the presence of blood in the urine as well. So that's the importance of the urinalysis. Then there are some blood tests we do, particularly the electrolytes, urea, and creatinine. So electrolytes, like I said, it checks the level of the sodium, the potassium, the calcium, the phosphate. Particularly also, it checks the level of the creatinine, which it helps in calculating the glomerular filtration rate, which is the function of the kidney. So is this blood test that is used to detect the level at which the kidney is presently functioning so that it can be addressed on time. Then imaging test. So we can do an ultrasound scan to check the size of the kidney, to check if there is any structural problem detected. Then they check sometimes if the kidney is having damage. There's something they call loss of cortical medullary differentiation. It just points towards that some of those cells in the kidney that are meant to be functioning, they're already giving way. Then sometimes if some of these tests are not enough, there are sometimes in some kidney diseases, like some of those inflammatory diseases or connective tissue diseases, where they have to go and take a biopsy. They take a sample. They take a needle through the back and take a sample of the kidney to check under the microscope to see exactly what is the problem going on with the kidney so that appropriate treatment can be made. So now we are ending towards the end of the discussion. So we'll talk about prevention. So this is the meat of the discussion. So prevention is better than cure, like they always say. So it's better to take care of the problem early enough so that it doesn't become more problem. Because management of kidney disease is very, very expensive. So first of all, is LD, eat LD. So eating LD, it means that you eat more fruits and vegetables, reduce salt intake, then take adequate water. The body tries to regulate water, but if we are dehydrated, it can result in kidney disease. Regular exercise is also good for the body. Then stop smoking. Like I said, smoking results in this kidney disease. Then if you are diabetic and if you are hypertensive, ensure that you maintain good control of your sugar and your BP. If it's not well controlled, visit the clinic so that they can do the necessary things for you. Then maintain healthy body weight. Like I said, obesity can worsen the kidney function. Then when you take drugs over the counter, make sure you follow the instruction. And then when the disease is not resolving, don't keep taking the drug. Make sure you just go to a clinic. It's better to prevent than to manage it. So, like chronic kidney disease itself is the acute kidney disease that is treatable. But in chronic kidney disease, there is no cure for it. So it's just managed. So the main thing is to treat the underlying condition. If it's hypertension, make sure it's treated. If it's diabetic, make sure it's treated. Then there are some medications that have been identified to slow down the progression of kidney disease. Some of them, they are used in BP, management of hypertension, like the ACE inhibitors, such as the lisinopril and losartan. Then some of them are used in management of diabetes, like the dapagliflozin. Then we prevent complications. So some of those complications, so when they are present, we give medications to treat them, or we also prevent them. We preemptively prevent some of those things from developing. Then when the end-stage kidney disease now results, so by the time the kidney function is less than 20%, which means the kidney is no longer doing what it's supposed to do, and all the symptoms will have accumulated in the body. By that time, there will be need for what they call dialysis. So dialysis is that they're using a machine to take over the work of the kidney. And by the time it gets to that point, it means that we know that the kidney works regularly, continuously. So if it's getting to that point, it means that the person will need to be doing the dialysis at least 3 times a week. And then that is almost for the rest of their life, except the person is able to get transplant. And I'm sure we've heard about the cost of transplant, the cost implication, apart from even being able to get someone to donate, and then the person even being able to match up with you in terms of being able to donate to you. So dialysis, if average cost of dialysis is about 50,000. If you do 50,000 per week, 3 times a week, that's 150,000 in a month. You know how much that will result in, and then talk more of a year. So it's a very expensive disease to manage. So the best thing is to prevent. Thank you, everyone.